I'm Alberta Spreafico, and I work at the Innovation Institute at Henry Ford Hospital as Human Development Programs Coordinator. The work I do aims to enhance access to healthcare worldwide. So let me start telling you a story. Let's go to the rural town of Las Salinas in Nicaragua. Las Salinas is 4 hours away from the capital city of Managua. And let's focus on the life of a young woman there, Maria. Maria grows up in Las Salinas and lives a simple and happy life. She's healthy, thankfully, because the road that connects Las Salinas to the nearest well-equipped capital hospital takes 4 hours to reach. Now, Maria becomes pregnant at the age of 18. Everything seems to be proceeding just fine as the local nurse records and monitors her pregnancy. Yet, before Maria goes into labor, she hemorrhaged significantly, and both she and her baby died. Now, what happened there? What happened is that she had a placenta previa, and the normal delivery of the baby is prevented. Now, where there's access to healthcare technology, this can be easily early diagnosed, and then Maria would have a simple C-section. Yet, both Maria and her nurse were unaware of the placenta previa. Now, we can help prevent this. We can save mothers, and we can save babies. This is an ultrasound machine, and this is a simple computer. Non-medical personnel, as well as nurses and midwives and non-specialist doctors, can be trained to use the ultrasound machine to do basic exams. They can also be trained to capture accurate images, and then those images can be streamed on the internet. So a physician at Henry Ford started training non-medical personnel and non-specialist doctors to use the ultrasound machine, and also to remotely guide them. Now, this is a potential that, if taken and integrated in the appropriate ways in systems worldwide, can increase access to healthcare. Let's say that I'm in the rural town of Las Salinas in Nicaragua, and I have a portable ultrasound machine that, first of all, is a resistant technology and portable, so to be able to be adapted in these specific rural contexts. I have a device that enables for the images on the ultrasound machines to be transferred to a computer and put online on the internet. The images from the machine are shown on the computer, and these images are then web broadcasted on the internet. Now, a doctor from Henry Ford will be able to access his computer. He will be able to see the actual ultrasound that I'm performing in Las Salinas, Nicaragua. He will also be able to call me on Skype, and through Skype and through seeing the images of my ultrasound exam, he will be able to guide me through the procedure and help me diagnose. At Henry Ford Hospital, we have a doctor who is remotely guiding nurses and midwives in the rural town of Las Salinas in Nicaragua to upgrade their education. However, with that not being totally sustainable, what we're working towards is working with the ministries to integrate our education, our technology, and the specific development approach across the country, so that it will soon be the doctors at the district hospitals that will remotely guide the midwives in the rural village through procedures to prevent early diagnosing placenta previas and saving both mothers' and children's lives.